you can still get infected. Let's get more on this with Head of the Division of Public Health Surveillance and Response at the NICD, Dr. Michelle Groome. Thank you for your time, Doc, and good morning to you. Let's demystify some of those themes, especially if perhaps we were not privy to the Q&A that you held this week. I mean, talking about, getting vaccinated, then getting infected with COVID-19, what are the facts there?
All right, so I think it's just really important to, for people to know exactly what a breakthrough infection is. So we would really, if you've been vaccinated and you get infected in a couple of days after that, that would not be considered a breakthrough infection. Then you'd be most likely to already have been in your incubation period. And so with any vaccine, we would really expect the immune response to really have kicked in by about, 2 weeks after infection. And so the CDC is defining a breakthrough infection as any COVID infection more than 14 days after vaccination. And this is after your full vaccination course. So if you received the J&J vaccine, it would be 14 days after that one dose that you get. But if for the Pfizer vaccine, where it's a 2-dose vaccine, that would then be kind of more than 14 days after your second vaccination. So you are starting to get, so for Pfizer vaccine, you are starting to get some protection even after the first dose. But we wouldn't consider that a breakthrough infection yet until you've had your full dose. So I think really just to understand that, anything too close to vaccination, and obviously we know that the immunity also does get better with time. And so you may use different cutoffs. When we want to have a look at breakthrough infections, and we will be monitoring these, you may want to look at, how does it compare, if you have a breakthrough infection, just after 14 days compared to maybe after a month or after 2 months.
Right.
And that will help us to know kind of how long the immunity to the vaccine is lasting. So at this stage, we only really have data up until about 6 months. So it does show that we've got good responses that long. And obviously, the more we can monitor, it's a new virus. So the longer we can monitor that, the more information that we'll have.
All right. So if I'm correct, you still encourage vaccinations, people to get vaccinated, even with these breakthrough cases?
Yes, so we know that the vaccines are not 100% effective. So, if it was 100% effective and you had 10 people that were vaccinated, all 10 people, would be protected and wouldn't get any infection. So what we are seeing with the vaccines, especially against, and with other vaccines we've seen similarly, most of you're getting protected against severe disease. So we want to protect against hospitalizations, we want to protect against deaths. And for most of the COVID-19 vaccines, and definitely for the ones that we're using at the moment, for severe disease, there's a more than 90% effectiveness. And it looks like it's even against these variants of concern. And so that means if 10 people are vaccinated, 9 of them will be protected against very severe disease. So that means there may be that one that may get, severe disease. But, instead of having 10 people die, or not die, but be hospitalized, you may now only be having 1. So you have a big reduction. And so your risk is really much lower of getting severe disease. So I think, we've seen this for other diseases as well. And so unless you have a vaccine that's 100% effective, we would, expect to see a few of these.
Right.
I think the other thing just to bear in mind is also the amount of infection that is, what we say is in the community. So at a time like this, we've got a lot of infections. Our infection rates are high, as you've said. We've got 7,000 cases in Gauteng, and so your chance of being exposed is a lot higher. As more and more people are vaccinated, there'll be less of that transmission. Because we know vaccinated people, even if they had to get infected, would have much lower counts of the virus. And so once there's a much lower transmission in the community, we would also be less likely to see breakthrough infections, just because there's less chance that you'd be exposed to the virus and less chance that you'd actually get sick.
Right.
So we would really encourage people, to continue being vaccinated. The more people that are vaccinated, the more we can decrease the transmission in the community as well. And so you may be able to, protect others that haven't been vaccinated yet.
Right. I want to get in
so
there, Doc, if you don't mind, due to time, and
we
ask you about these infections you were speaking about, particularly when we're looking at Gauteng and perhaps the likes of the Western Cape. Even though we're still seeing, quite a high number, because, I'm of the theory that one infection is one too many, because it could spiral out of control and, infect another person. What is data showing us about particularly the third wave with these numbers? Are we out of the clear in Gauteng? Are we still on high alert, especially when we also compare to other provinces where we're seeing quite a spike there?
Yeah, so I think Gauteng, you just need to remember that, we are the most populous province. So those numbers are high because we do have a high population. But Gauteng has really seen a large third wave. I think there are indications that the numbers are starting to drop. I mean, if you remember, we were up to, over 15,000, a week or two back. So there definitely are early indications that we've had our peak and that we're on the way down. So I think it would be, if these numbers persist, then I think we can kind of safely say that at least for Gauteng that we have reached the peak and are on the downward spiral. I guess the only caveat with that is now with, obviously this week's, unrest that potentially, there may be some, super spread events that come out of that.
All right, we'll leave it there, but thank you for talking to me. Head of the Division of Public Health Surveillance and Response at the NICD, Dr. Michelle Groome.